Now we are moving to the sessions proper. Our first speaker is Dr. K.M. Abul Hasan, sir, the State President-elect of IMA Tamil Nadu. Sir is the chairperson for IMA Medical Students Network and IMA Junior Doctors Network Tamil Nadu. He's the chairman of State Executive and IMA and he's doing extensive charity along with the entrepreneurship activities. He's not only a leader by himself, but has created several leaders. If someone would call me as a leader, then Dr. Abulasan sir is solely responsible for it. So who else could be the best person to talk on the topic leadership skills in health entrepreneurship? Hence, I would like to request and invite Dr. Abulasan sir to enlighten us on this topic. Over to you, sir.
Thank you, Venkatesh. Good evening, all my dear faculties. I welcome all of you for this wonderful session on healthcare entrepreneurship. I just share my screen. Are you able to see it? Not yet. Yeah. Okay, Venkatesh?
Yes, sir.
Yeah.
Yes, sir.
I'm very happy that I got this topic today because I feel, these two things, leadership and entrepreneurship are very rarely talked in medical profession. Now we have to combine both the things, and I am sure I'll be able to do some justice as I have traveled in both the ships, both entrepreneurship and leadership. Let me tell you briefly in the beginning why this entrepreneurship is important in this present scenario in the healthcare is concerned in our country. There is a booming healthcare industry in India. Never before we experienced that this particular industry has never gone into recession, where other sectors go into recession, come back, go to recession, come back. But this healthcare industry is very steadily, increasing because of growing population, increasing affordability, comparative and cheaper treatment costs compared to other countries. Increase health insurance. This is very, very important. Out-of-pocket spending is becoming less and less today. And increase patient awareness about maintaining their health. And the government also initiated some of the public-private partnership programs. This healthcare boom in India is because we have a strong economy and we have a culture of saving and increased options in healthcare financing. Private equities have come in large number to fund our clinical establishments and better profitability, earlier break even medical tourism, and increasing demand from within the country. Domestic demand itself is still huge for healthcare establishments to come up. Of course, we have to look into the changing customer aspirations, like they want quick response, quality care, less waiting time. This kind of thing, kind of corporate culture is emerging, and it's very important that price is not at all a matter today. Of course, there is a concern there, but the people want quality and also corporate culture. And there is still scope for many, many small hospitals to come up. For example, if you calculate the number of beds required to meet the WHO's standard, that is 4 beds per 1,000 population, we need to develop 30 lakhs beds today. And of course, there are people who are getting aged. They are getting more and more problems. Every citizen is having some kind of problem, diabetes. Everything is very common here. And there is a scope for newer hospitals. Of course, there are some areas which are been a headache for establishing hospitals like laundry, kitchen, laboratory, pharmacy, everything we used to single-handedly manage earlier. Now you can outsource all these things. The future going to be like this. There will be multiple single specialty centers, retail clinics. There is another strategy about that is operations and management contract. You can give a land, give money to somebody, and they will build a hospital, run it, and you can only practice peacefully. These kind of things are coming up, and many hospitals are now targeting second and third tier cities. Large hospital also are coming, and there is urbanization rapidly happening in the country. This is another reason that tier 2 and tier 3 cities have huge demand for secondary and tertiary care centers, because people have moved from villages to these cities in large number in the past 2-3 decades. Opportunities in tier 2 and 3 cities, because it is comparatively affordable. The healthcare services are affordable, accessible, and also there will be some kind of personal touch compared to other big cities in metros, where you have a very good opportunity if you are concentrating on these three aspects. You are likely to succeed in our entrepreneurship in establishing a healthcare establishment. And every entrepreneur in medical profession should keep this in mind, that is patient delight. The patient expectation is always less. We don't get this particular point very carefully. And if you try to exceed their expectation, there will be delight. The patient will be very happy, and you have to concentrate on promptness of service, all treatments under one roof, standard operating protocol, and of course, you have to have a very neat, clean infrastructure and also clean people, and they will be definitely having very highest degree of patient delight. And I always tell this 5-point formula for every entrepreneur, because entrepreneurship in medical profession is, comparatively more holistic, more it should be satisfying to the entrepreneur than remunerative. In every business, the remuneration is the most important thing. Here it is slightly different. So I would like to tell as a first point that the science of medicine is a fascinating field. You have to have a very good passion, very strong passion to dwell in this entrepreneurship and medical profession. Otherwise, it will be very difficult to enjoy your activity or career joyfully. And learning is a continuous process. You have to be subject mastery. If you want to establish a hospital, and you have to be very thorough about this, not only the subject and also the hospital management, and develop profound sense of values and ethics and live like a professional. This is very important for all entrepreneurs who come up. There are so many ills in the medical profession because of this particular point. There is deviations in values, ethics, and we have to be very honest to the people, honest to the professions, honest to the knowledge we have. So we have to stick to these values and ethics. And number 4 is stay connected to the society. Not only that you establish a hospital and make a break even, make a profit, all these things, but you have to give back to the society in the form of, for example, in the COVID pandemic, many of the hospitals have opened their gates for COVID patients, even free treatment they are offered. So at the time of crisis, at the time when you are needed for the country, you have to give it back, give your services to the country. And finally, remember this, remember you have become a very important citizen of the country once you establish a hospital, because you remember that anytime you will be wanted, you have a very major role to play as a hospital owner in the country. And I would like to project few of the heroes, the leaders. I convert them as the leaders. We always cherish our leaders who they used to be scientists, they used to be inventors, starting from William Harvey to so many people who invented so many theories, all these things. But these are the recent heroes James Marshall, who invented H. pylori. He swallowed the H. pylori bath himself, and then took an endoscopy and proved that his stomach colonized H. pylori. Stomach antrum colonized this bacteria, and then only the whole world believed that H. pylori is the culprit for peptic ulcer. Now, Jacques Moresca is the one who did a telesurgery, robotic telesurgery, very exciting from one place to another place. And he did through him only this particular field has emerged into robotic surgery today. And Frostner is the one who is the father of angio today. He himself cut open his basilic vein in the cubital fossa and then introduced a catheter and took an X-ray and showed the world that he could reach heart through his one of the vein. And after this only, today angio has replaced most of the surgical procedures of the heart through catheterization into the heart. This is the man, one of the topmost entrepreneurs in the country, and he has been named as the richest doctor in the world today because he has invented this cloud and also invented a drug called Abraxane. I would like to show this. I want to remind many of you might remember her when I show this picture. This is Dr. Muthulakshmi Reddy. For me, this is she is one of the biggest entrepreneur in the medical field in India. She was named as first Indian woman doctor, first Indian woman, so many things. Of course, before her, Anandi Ben Patel was there, but she was the only first Indian woman doctor who practiced, who had her career as a woman doctor successfully. That's why remembered as the first Indian woman doctor. But entrepreneurship quality she showed was tremendous. Because of her entrepreneurship quality, now today Adayar Cancer Institute is standing as one of the tallest oncological institute in the country. She started this, and with all difficulties, there was so much of mortality at that time, and all her colleagues were discouraged her to not to start an oncology ward, but but still she started and dedicatedly worked. Her son joined later, and one interesting fact I would like to tell here is during emergency time, when she was, that her hospital was in infancy, that was closed down because there were number of deaths were more in the hospital. So somebody told that so many people are dying in the hospital, so it was closed. Then after lobbying, this was again open. So much of difficulty. Now today is one of the biggest hospital. More number of surgical procedures in oncology are being done in Chennai, in Adayar Cancer Institute. This gentleman is another modern entrepreneur, established Apollo Hospital, chain of hospital, and is a father of modern healthcare today. And this Mr. Dr. Devi Shetty, who had revolutionized the cardiac operations. One of the, again, a leader in the medical field, and also I can call this most successful entrepreneur, and converted the heart high very costly cardiac surgery into a very cheap and affordable cardiac surgery in our country. And this gentleman, founder of Aravind Hospital, another important entrepreneur in medical field today. He started his hospital only after 60 years, after retiring from government. This is one of the important point all of you must know, that he started his hospital after 60 years development. Today, it is about expanded to so many countries also, 42 hospital. I think there are 16,000 surgeries are done every month in all the hospitals of Aravind network. This gentleman is Dr. Jerry Brown. He is the man who stood in the time of Ebola outbreak in Liberia. He's a general surgeon, graduated from London, and he when everybody was running out of the country because of Ebola outbreak, he's the one he started a hospital entirely for Ebola with his nurse and wife, and treated 2,000 people with the Ebola outbreak. Now, coming to the leadership as such, I think there are 5 kinds of leadership, like personal leadership. I will come to that later. The circumstantial leadership, you understand that what it is. autocratic leadership or consultative leadership. Finally, servant leadership is the one who's kind of, please somebody and become a leader. But for a medical profession, I prefer this leadership only. This is a personal leadership. Personal leadership is your activity to realize your worthwhile predetermined goal progressively. This is the most important thing I advise for every medical entrepreneur or new young doctor who want to establish a career as a as a doctor, as a medical entrepreneur. Personal leadership is a continuous journey upon which you consciously and deliberately embark on becoming the person you want to be to realize your potential. IMA is the best platform to develop this personal leadership among doctors, among young medicals. That's why I invite people, young doctors, medical students, junior doctors to IMA to develop leadership. Even I have written a book on tips of improving a leadership quality that I will show in the last. The most important thing I again and again emphasize the personal leadership. Personal leadership, you put a goal in front of you and make a journey towards the goal and achieve it. This leadership is nothing but a ownership. As a famous poet Bharati said, "Nam irukkum naadu nammadu enbadu arindam." In Tamil, that means the country which we are living is our country, is our property, our wealth. So if that thing is instilled in the mind, then the entrepreneurship will be very holistic. Doctor as a leader, if you develop a leadership in the hospital, in the society, there are so many benefits. In the hospital, the emergency, elective operations, you lead from the front, and all the subordinate nurses will follow you. Definitely, there will be better patient outcomes, clinical performance, and also professional satisfaction. To develop this kind of leader, there is definite, workshop kind of things are there, modules are there to develop these friendships, leadership for doctors, and also in the society, and take ownership and develop a leadership and have a strong connect to the society as we did in the COVID era. And also we are doing this BLS program from JDN and Amazon platform. And that is the kind of leadership and you take. And for example, another simple leadership technique, when you travel in the aeroplane or the car, somebody is fainted, somebody had a cardiac arrest, you run to them and then give the first aid or give the CPR. That is the leadership. That is the leadership quality as a doctor has to have. These are the programs I have so far achieved in my career because of showing some kind of leadership and put an example for others to follow. This is a book, I have released. There are 100 tips I have given to be a leader in the medical profession. There are investment opportunities galore. So many opportunities are there in the country for a healthcare entrepreneurship. You can start a hospital, start a clinic, as a diabetic center, daycare surgery center. You can also start education centers like medical college, nursing college, paramedical college, alternative medicine hospitals, diagnostics, and there are so many other newer technology like as an operation and maintenance contracts and so on. The diagnostic is another big market is awaiting you. You have to understand the market dynamic. You can start a diagnostic as well as imaging centers. There are so many other wireless technology. Just now our Narayana said about this Canbo technology. There are so many things are like a Google Glass. It's very, very useful while operating, and electronic ICU. There are so many things are available. Invented and imported from other countries. You can produce all these things in our country itself. Another area you will have a lot of entrepreneurship potential is the fitness industry, gym and wellness centers, and also treatment rehabilitation for sport injuries. Wellness industry, of course, you can develop so many apps are there in the market. Some more demand is there for this kind of apps, mobile apps, yoga, Ayurveda, and managing non-communicable diseases, and online courses about wellness. All these have a very good demand, and definitely you can find some good career in these particular areas. And remember, this Indian healthcare is so much. The volume is so much. The over 60,000 cardiac surgeries are done in our country per year. And also multi-organ transplants like renal, liver, heart, bone, everything is done. And people from 55 countries coming to India for treatment. So there is a statement in India vision that physicians, nurses, medical technicians, and other scientific occupations will become rival to growth industries like IT sector. Now, today the IC sector, the top most sector which contribute to GDP as of now today for India, and in due course, this will give a challenge. This our medical sector or healthcare industry will definitely will give a challenge to this IT sector. Almost it will grow equally together. With this statement, I end my talk, and I have should not think that I have given only the rosy picture of the medical profession today. There are, of course, there are so many challenges, but only one thing is starting our entrepreneurs entering into the entrepreneurship is not that challengeful today. Maybe running it, sustaining it, there are so many challenges, but starting definitely is a very, very encouraging one as of now today in the healthcare industry is concerned. Thank you, Dr. Venkatesh, for the wonderful opportunity.
Thank you, sir. Thanks a lot for the wonderful session. So many things you put in slide. That is the thing you routinely say to us also. IMA is a blank canvas. It's a white canvas. You can write whatever you want.
Yeah.
So I could connect a lot of things personally. I'm pretty sure that many more leaders will be made in our fraternity owing to your continuous efforts, sir. Thank you so much, sir.